daily update from the Wayne County Sheriff's Office. I'm Captain Doug Hunter. A special edition today. We have Nick with us from the Health Department. You've seen Nick over the past several weeks speaking to you on videos. Felt like it would be a good opportunity for the two of us to get together and talk about what's been going on for the past few weeks. We're doing our best to maintain our social distancing, so it might look a little awkward here as we go across the table. So, Nick, thanks for being here today. And what's been going on with the Health Department? I know you guys are always there each and every day, year after year, but all of a sudden, you are center stage.
Yes, we are. Not always the place you want to be, but a necessity. We need to serve the public. We need to do our part and slow in the spread of this thing. So thank you for having me. And I certainly don't want to take all the credit. First off, I want to thank the community, the residents of Wayne County, the businesses of Wayne County, who have complied with the stay-at-home order. We have flattened the curve, I should say, as a community. Nothing specific that the Health Department did, although I'll talk a little later about things specifically we've done, as well as other entities in the community. It's definitely a community effort. Obviously, health departments and incidents like these do take center stage, but nonetheless, we could not do it alone, and we could not do it with all of our community partners. But the residents and the businesses that have made the sacrifices during the stay-at-home order have really helped flatten that curve. I can't say enough the appreciation I have.
It's been a difficult time. I know when the orders first came out, I was receiving a lot of phone calls, and I know your office was as well. People looking for interpretations. How does this apply to my business or my lifestyle? We were swamped with those types of calls. I'm sure you were as well. And I actually diverted to just telling people, here's the order, and figure it out. Because as sure as I made an interpretation that could be interpreted by a judge at a later date, my interpretation could very well be wrong. I would, do my best guess and apply. But what were your experiences with that?
I would say that would probably be very similar. Our environmental health unit kind of took the lead on that piece, enforcing, especially as it related to essential versus non-essential. And even having said that, we could not do that without law enforcement. Folks like yourself, local police departments have been very helpful in that regard. I think one of the things when the governor established the dispute resolution process a couple weeks ago, also I think it took some of the pressure off of us. So if we didn't interpret it correctly, there was this other body that would make the correction. So I think that was certainly helpful. But about the calls, yes, we had plenty of calls ourselves. But to help us with that, I think one of the things that was done early on is collaborating with our local EMA to establish a joint information center, as well as with the United Way. And the United Way really stepped up early on in this and volunteered the wire, essentially, to be a call center to kind of filter some of those calls. Now, obviously, some of the calls that they could not answer would then get pushed to us. Things like the stay-at-home order, if there was something that they felt they needed to push on to our environmental staff to do the interpretation, or if it was a medical specific question, they would send it to our nursing unit. But certainly, yes, that was very lot of gray there. But I think that with the Dispute Resolution Commission that was created a couple weeks ago to kind of look at these issues, it certainly helps us so that, if you were to interpret something wrong, or I or myself interpreted the order wrong, it would get corrected, and no harm, no foul. Basically.
Yeah, certainly a lot of behind-the-scenes activity taking place. I know as part of a meeting with yourself and with Joe from EMA, which is where we're at now, by the way, folks. This is where we're at the Justice Center. Anyway, a website was quickly formed and has been kept up to date with various bits of information that hopefully people are finding helpful, and a level of transparency. But what people don't see oftentimes is part of the question. I mean, there's been many conference calls between yourself, law enforcement, hospitals, and so forth. Let's talk about some of the things that people really maybe are not aware of. but have been ongoing since when this thing started off.
These activities have not been planned in a vacuum. As you indicated, pretty much every kind of group, whether it be law enforcement, emergency management, health department, hospital systems, we've all had conference calls kind of with our own groups, and there's also been some integration to some level. Locally, we actually have had, and we have 2 standing calls per week that our EMA, Joe from EMA, kind of helps facilitate that. One is kind of a community level group, so we have a lot of folks on that call. So it would be first responders, hospitals, mental health providers, social service agencies, any groups even you wouldn't necessarily think would be kind of involved necessarily in day-to-day stuff, but have a crucial role, especially as we shift to more of a recovery mode. And then we have another group which is pretty much just kind of that responder group, which would be first responders, hospital systems, EMA, and the health department. So we've been doing this collaboration since the outset of this thing, or early March, I believe. So as far as that goes, there's a lot of community collaboration going on with this. You heard me mention, EMA putting the website up for us, starting, helping us to start the JIC. United Way's help in utilizing the wire as kind of a triaging call center, so to speak. All of those entities have been very helpful. Things we do at the health department, we have already mentioned interpreting the stay-at-home order and working with businesses. And it's not just about businesses. There's also the social distancing pieces of that too. So any kind of mass gatherings, looking at trying to mitigate those things. But as far as preventing the spread of this disease, one of the things our clinical staff does that isn't always necessarily talked about is what's referred to as contact tracing. So when we get a positive result on somebody, our nurses, our communicable disease nurses, really try to find out, okay, you have this. Have you had any close contact with anybody? And then if they do report some close contacts, our nurses will go ahead and make that next jump and try to contact those people and try to ascertain what level their understanding is of their contact with the person who was infected. And at that point, the nurse makes a determination whether or not that person should also be quarantined, because what that does is it helps prevent the spread of disease. I don't think what people don't realize is that we do contact tracing with other types of infectious diseases as well, but we're in the world of COVID-19 now, so it's obviously it's much more escalated in the activity that needs to be done on our cases. So that's another big piece of what we do. And our reporting comes from, just so anybody knows, we get reports from primarily hospitals, and because they're doing considerably the bulk of the testing. So we work a lot with the hospital systems on trying to find out not only they're reporting to us who are the positives, but also who those contacts, those close contacts that may also need to be quarantined.
You talked about your staff, and I have a pretty good idea of what your staff consists of because I interact with your office routinely, but a lot of people at home do not know that. When you talk about your nurses that are doing this follow-up, what's the size of that staff?
We have 5 staff nurses and a nurse that acts as a supervisor, and then we have a director of nursing who also oversees our WIC program in addition. So, but our supervisor and our nursing director, it's all hands on deck.
And those people are staffed year-round.
Yes.
Which means they're busy year-round.
Yeah, and
without a pandemic.
We've had to obviously see some operations and reconfigure some things so that they're primarily doing that right now.
But the other things, the other problems just don't go away.
No, and we are dealing with those. In fact, we've kept actually all of our offices open, but they're by appointment only now. So it's a subtle difference. No matter what services we're doing, from birth certificates to septic and well permits, as necessary. Obviously, we don't want to be doing a whole lot of that right now because we want to practice what we preach in terms of social distancing. But we still need to kind of make ourselves available for those services because the community may need some of those other services. So slight change in the way we're operating. A lot of times, a lot of our services are walk-in as people needed, but we kind of need them by appointment, not only to maintain that the social distancing aspect, which is so important, but also just to be able to still take care of the public in the midst of this.
What do you think things look like for Wayne County in the next couple of weeks? A lot of talk about May 1st, and people that I've spoken with recently, I'm getting the impression that they think May 1st this virus is all gone, but I know that's not true. But what do you think it's going to look like here in Wayne County over the past couple
I
of
don't
weeks?
have a crystal ball, but my sense is that May 1st will come, and some of that order will get relaxed, but it's not going to be a flip the switch back on. Everything is like it was in February. I don't see that happening. And even as it is as a gradual reopening of the state, if you will, our lives are going to change forever. I don't know that people realize that. I don't know that we'll all be wearing masks all the time. Or whatever those requirements will be, which I don't know. But I would say in the next week or so, it'll be in the news what the governor's plan is. I know that there is a plan to reopen the state or to relax some of those aspects of the order. But I do believe that our lives will change, much like they did post 9/11. Our lives will change. There will be. I think we will see some differences. I know with 9/11, the easiest reference is when you travel on a plane now, how that process has changed. I don't know what processes will change in particular, but I know one of the things that have been talked about is, the handshake may be a thing of the past, and that may be. So our lives will change, not just in Wayne County, not just in Ohio, not just in the United States. Our lives will change. We'll do some things differently to help to prevent of the spread of diseases, not just COVID-19.
What has been the biggest struggle for the health department with this recent outbreak?
I think that the biggest struggle is the uncertainty of how this virus is going to behave, the uncertainty of who it impacts. I mean, we hear about, obviously it disproportionately kills the elderly and people who have compromised immunity and certain chronic conditions. And then you hear up to 50% of people have no symptoms to this thing. And there's just a lot of uncertainty to it. And I think that uncertainty makes it difficult because it's not a typical infectious disease that my nursing staff is used to dealing with. The stay-at-home order, I think the intent was for folks to kind of police themselves, but obviously health departments in conjunction with law enforcement is to try to be the conduit for that. So a lot of uncertainties, and I think that's made it difficult to address this on many fronts.
I know from the law enforcement standpoint, this is a situation we found ourselves in that I had never anticipated. I've been doing this for nearly 40 years. Mm-hmm. And now we're getting calls from people who are, I hesitate to use the phrase tattletale,
right,
but they're saying, hey, my neighbors or this church group or that is doing this. And, we don't envision ourselves in this spot of trying to interfere with people's constitutional rights,
right.
And we take this stuff very seriously. And we've had some cases where we were close to maybe sending it to the prosecutor's office or taking some type of action, but we haven't. So this is one of these things from the law enforcement community that we struggle with. People will call us and say, well, an Amish wedding, for example, is taking place. Well, the wedding's allowed to happen,
right,
but the reception is not, and we have to go and do this educational piece. And we're really thankful that we've received the cooperation from the members of the community. Some people have kind of pushed it and so forth, but it's an uncomfortable spot for us to be in because these are not the type of laws that law enforcement are accustomed to enforcing.
and not even health departments for that matter. I mean, you know, the example you brought up, there was an Amish wedding that was going to occur. Now, you know, we're looking at the order. The order's pretty clear. You can have the ceremony. The reception needs to be limited to 10 people. So, you know, and I don't want to just say Amish, anybody,
Yeah.
any wedding, but
Certainly.
that was kind of one in particular I know that we dealt with. But yeah, I mean, even health departments, we're not used to enforcing an order of this, certainly of this magnitude and of this scope, and how it, I don't want to say interfered, but it you know, it made a lot of people make a lot of sacrifices. We've never
sure.
seen anything like this. Now we try to learn from lessons from the Spanish flu from 1918. You could either do the St. Louis route or the Philadelphia route, and basically those two cities responded differently. St. Louis, kind of, Ohio and lots of other states did more like St. Louis. A lot less death, a lot less people getting sick. Philadelphia had parades, what have you. A lot of people got sick, a lot of people died. So I think that was a lesson that was learned over 102 years ago, that a lot of places put into place, Ohio included.
You know, talking about the public, certainly there's been sacrifices have been made, but we cannot say enough about the citizens here in Wayne County who have stepped up and made donations. There's a lot of PPE equipment behind us, or at least it looks like a lot. In reality, it is not that much, and this will be delivered soon, and a lot of it already has been put out to the first responders and others. But again, we can't say enough about the public's outpour of support, people making masks and going the extra mile, you know, not going to work, and many places have shut down, and of course we're hopeful that those will recover.
Absolutely. I really appreciate, because the level of PPE that we received in the Strategic National Stockpile was not very much. We received 3 small deliveries. It was nothing that Joe and I couldn't handle ourselves, Joe from EMA, as far as that goes. So
how was that transported? To give people an idea, did you have to rent some Ryder trucks or anything like that?
No, we did not. All those fit in the back of Joe's pickup truck. We basically met, which had a big 53-foot semi, and was very barren.
You met the 53-foot semi.
We met the 53-foot semi, and Joe and I kind of put it into his truck, and we took it to an undisclosed location. Obviously, we don't want to reveal that, but that most of that has also gone out. We got that out to the hospital systems, and then there's some left over for nursing homes as they need it and request it. And certainly, we want to get it out. We'd rather not it be at that undisclosed location. And then, as you indicated here, a lot of this stuff was for, our first responders, the stuff that was donated. Also, we're looking at, working with some of the social service agencies, especially those that are in charge of communal living, where people live together. Working with the homeless is one of the other pieces that the EMA and the health department are working on with some partners in the community who that's what they do anyhow, is work with the homeless. But what to do in the case if they have a COVID positive 19 homeless person, or in one of the social service and mental health agencies that have group homes, so those kind of congregate living, so those types of things. So.
Okay. Is there anything else that you'd like to talk about?
Well, I want us to stay vigilant, even as this order is lifted. I think, as I said at the outset, I really appreciate the residents and the businesses of Wayne County making those sacrifices, doing the social distancing, staying at home, not going out if you don't have to go out. We're still going to need to keep that up for a little while. And post May 1, I don't know what that will look like. It will be some version of that. I do anticipate, as the state does start to open up a little bit, I think we will still continue to see some spikes in cases. It's not going to shut off May 1st. We're in the midst of right now kind of the peaking part. I think in the next week or so we'll still be kind of peaking. I know we're somewhere in the ballpark of 80 cases right now. I still think we will still see some increases. I think we'll still see some increases in deaths, because those will tend to lag behind. So I would just ask that Wayne County residents still continue to stay vigilant with this. ask for their patience. I know we've been very patient. We've been kind of doing this for 6 weeks now or so. It's going to be a little while longer, and I think for the health of our residents, we're still going to continue to need to make those sacrifices. I do think May 1 we'll start to see some of that relaxed, as I said, but I think relaxing of it will also cause some of those spikes as well. So, but life will be different. Even after May 1, I don't know that we'll ever go back to the way it was February and prior. So I just want Wayne County residents to be prepared for that. As I say that, again, just appreciation for everything that the community has done, our EMA, our local law enforcement, our first responders, our hospital systems, our nursing homes, our social service agencies, our human service agencies. Folks, if you're not affiliated with any of those things, we have a group of people from disparate, different types of agencies doing different things, but with the common goal of taking care of each other. And I couldn't be more proud of all of them, as I am proud of you, really sticking to this order, or keeping to it as the best as you could. So I guess that's the last thing.
One of the things, talking about the numbers and talking about the roles that people have played, and certainly there have been a lot of people that have stepped up and made donations, making the mask and so forth. But really the most important thing that I can see, I was a part of a phone call here a couple weeks ago where the hospitals were talking about the projected number of the surge.
Yes.
And they were talking about a number of
Thank you for bringing
300.
That up. Thank you for.
And it was just an astronomical number in my mind, and there were arrangements being made for alternative sites to, put overflow people that needed medical care. And the most recent number had shifted from an excess of 300 to a surge of perhaps less than 30.
Yeah,
and I think people can give themselves a big pat on the back.
Thank you for
staying home. And we hear that phrase, flattening the curve, and you still see cases happen, and they're going to keep happening.
Yes, they are.
It's just not going to stop.
Thank you for bringing that up, Doug. I think that's another thing that Wayne County residents should know is that, I said flatten the curve. I said flatten the curve, but this is what it really comes down to is the work that the Wayne County residents have done and the sacrifices that you all have made has flatten that curve.
They've smashed the curve.
The surge that we were predicting, and I shouldn't say we, it was the modelers at Ohio State or Cleveland Clinic, I can't remember which model was actually used, was saying, into the hundreds. And now we're looking at perhaps less than 50 at our peak. And that certainly helps our hospital systems out. I mean, that they don't have to prepare for the surge if things go as they say, which I hope that they do. But we did look at, worked with the REMA, worked with the hospitals on alternative sites, and we had some established, and perhaps we won't need those. And you know what? That's great. But there's nothing wrong with being prepared, because who knows? Even these projections, although they're good, again, when you asked what's the kind of the most difficult thing about this, is really the unpredictability of this virus. I mean, it's predictably unpredictable.
Yeah, there were a lot of plans made that have not needed to be executed because people have done their part.
Yes.
And that curve has been flattened. When we talk about flattening the curve, the goal was not to overwhelm the medical system.
Right, and that was the main goal. And as far as I'm concerned, if we keep on this path, we've succeeded, and that's a testament to Wayne County as a whole, residents, businesses, donations, the whole thing. Our healthcare system, our social service agencies, our emergency management, county government, hospitals. I did say hospital systems, law enforcement, and I know I'm going to forget somebody, but
there's a lot of people helping out.
There's a lot of people engaged in this response to this deadly thing.
And one of the things that I've shared with the people that I talk to is when you have situations like this, when it's all over and done with, and this will be over and done soon, hopefully, but the cases will still happen. But for the most part, this will be folded up, and people are going to look back and they're going to look at the people who were in positions of leadership and say they should have done something different. Either the case that they overreacted, they underreacted, they should have acted sooner, they did too much or too soon. But the reality is the people that are in various levels of leadership make the best decisions that they can with the information that they have, and folks can armchair quarterback
Yeah.
after the fact that were never heard of before.
Yeah, and that's fair. I mean, I agree with your statement. Anything that I've done as a health commissioner, I've done with the information that I had at that point in time. If I had the information in June to make that decisions I had to make in March and April, I'm sure I would have made.
Yeah.
There would have been some decisions I would have made better. But to your point is, we make the decisions with the information that we have in front of us at the time. But I do think there will be some things to be learned. One of the things when you have incidents like this, or any type of emergency incident, one of the things that you do is an after action report. And that after action report will probably have some of those things, so that, let's hope we don't have this again, but if we do, next time we know we need to change up our plans, whether it's plans in our county emergency management agency, the plans in the health department's emergency planning, or other, hospital emergency planning, any entity that does emergency planning, they'll add those things to their plans. And it's not perfect. It's never going to be perfect. I'll be the first one to tell you, as this is all said and done, as your health commissioner, I know I wasn't perfect. I'm sure I'll maybe have made some missteps on the way. But I think we can all say that as anybody in leadership positions. But one thing I can tell you is that two things that always guide my decision making. One is I always look to see if it's in the best interest of Wayne County residents. And the second thing is to make sure that I'm acting within the confines of the law. I mean, those are the two things I look at. But if it's in the best interest of Wayne County residents' health and safety, that's going to guide a lot of that decision. And secondly, but not as equally important, obviously, public health has broad sweeping powers, but it's not without limits. And I think that's also important to note too.
Okay, very good. Well, it seems like no better time to remind folks to think a little more of others and a little less of yourself. And things will be a whole lot better right here in Wayne County, Ohio.